This video is a follow-up of this video. I just wanted to explain that I will be telling Brandon's health story for him over healthy videos of him enjoying our dogs, because that's what we're aiming to get him back to.
This is going to be part 2, and it's going to be more of an update of what we've been doing since posting our initial videos. I do apologize for the large lapse in space between videos. Our family has suffered a couple of large life events, one being that Brandon's uncle, a very beloved man, has passed away, and the other being that his mom has been hospitalized and had her leg amputated to save her life. She will likely have to be put on dialysis as well. So unfortunately, we are going through a lot of things, and it's just been kind of a process amongst dealing with all of Brandon's appointments and things like that. The good news is that we have put together a green file for Brandon, so we are well prepared and have all his appointments, all his up-to-date labs, all of his different diagnostic testing all laid out in a binder, which was great. We also have sought out a clinic that we know 2 of the doctors who were good to him in previous ER visits work at. We did not end up with those doctors upon walk-in visit because they're not taking family patients, but we did get another young doctor who's really eager to help us. She even went as far as phoning the U of A, which none of the doctors have done, and asking the urologist what he would suggest we do in the meantime. The urologist did not suggest doing anything further testing. However, she said herself, she says his case is not normal presenting. What would normally be testicular cysts normally don't cause this much pain. So there has to be something else going on, and that is going on at the same time, but does not maybe even correlate or have anything to do with his testicular cyst. So on the 24th, he has another appointment with her to look at upgrading to different medications after trying a couple weeks of what he was put on by emergency. He has been holding out on going to emergency because of our last couple of bad visits, one being the Wetaskiwin ER, and having the doctors and nurses fail to see that he was having a mental break, and instead viewed his distressed episodes as him being disruptive to the ER. And so he was walked off property, as well as I was, for recording parts of his care that I didn't see were accurate, and I wasn't aware that there was a recording policy on site, but that is what it is. There's nothing that can be done about it. I needed to know what information was being given to me so I could relay it to another family member. I have not posted any of those videos publicly. And then the other was the U of A. Upon everybody's suggestion, he had gone 2 days after the Wetaskiwin ER visit, and they unfortunately said that the urologist is doing everything that they can do. Coming here won't fast track his referral, and they sent him home with more medications that were anti-inflammatories, despite being told he's not allowed to take anti-inflammatories and Advil with his stomach ulcers. So that was a little bit frustrating. It was like hitting our head off of a wall. And so the follow-up visit with this other doctor from this family clinic is going to be our next best bet. Like, she has us as a follow-up for walk-in on the 24th, and despite us not being a patient of hers, she's eager to help us with getting an MRI referral because she does think it could be something else. So thankfully, also via TikTok, we have had a private MRI donated, so he will not have to wait the 4 to 6 months to get that done. So as soon as we have the referral on the 24th, that'll be sent into a private clinic in the Red Deer area to do the imaging. And so we thank that individual immensely for donating that to Brandon's care. And hopefully we will have some insight, because there's just a lot of other options that could be going on causing this. Disc issues, a mass in his prostate that's been not found by ultrasound. There's just a whole, a laundry list of things. And unfortunately, there is a case known as the Greg Price case in Alberta, and this is not the first time somebody's gone under the radar with a major illness and been told they're fine repetitively and sent home with meds. We're looking forward to updating you guys more on how his care goes throughout the next couple weeks. Stay tuned.